Young adolescents aged 10 to 14 years living in Kenya face severe challenges. They are vulnerable to early and unintended pregnancies, injuries and death from unsafe abortion, female genital mutilation, FGM, child marriage, sexual and gender-based violence, malnutrition, and sexually transmitted infections, STIs, as well as HIV and AIDS. Kilifi County is one of the places in Kenya where these challenges affect adolescents even more severely.
There was one case of pregnancy ambapo mtoto alipata ujauzito, hata kuja kufanya mtihani hakuweza kuja.
Kabla hata hii DSW waje na ile gas forum mpaka wapatie sodo, wengi walikuwa hawaji shule, yani wanakosa shule kijinga kwa sababu wengi wanasema basi mimi nikifika huko shule naibika. Kwa sababu gani? Wengi wananiambia basi huyu kila kati nini skati yake imeloa nyuma kwa sababu ya.
It is with this knowledge that DSW, in partnership with Bayer Healthcare, designed and implemented an intervention to 1. Increase sexual and reproductive health and rights knowledge, skills and access to services among young adolescents aged 10 to 14 years in 27 primary schools in Kilifi South Sub-County, and 2. To create a supportive school and community environment for young adolescents' sexual and reproductive health and rights.
Basically, we used to mentor these schools. We established clubs, call them YAP or Young Adolescent Project clubs.
Kujua how to control peer pressure and how to take care of myself.
Nilianza kuangalia vile wale watoto wenye walikuwa wamechukuliwa wanaendelea na haya mafundisho vile walikuwa wana behave. Walikuwa ni watoto wenye tabia nzuri, wenye heshima. Hata wengi wao mwaka jana walifanya mtihani class 8 na namba yao ya members ndio wenye walitokezea na marks zingine za juu kupita hao wengine.
Since 2013, DSW has been working with various stakeholders to support young adolescents living in Kilifi South Sub-County to enjoy healthy lives in a conducive environment for their sexual and reproductive health and rights. DSW's intervention has increased sexual and reproductive health and rights knowledge and skills for pupils in 27 primary schools in Kilifi South Sub-County.
The program has a positive impact to create some awareness to our pupils, to the young adolescents.
By 2019, DSW's intervention reached a total of 10,293 young adolescents with sexual and reproductive health information and services. We also provided 5,640 sanitary towels, 470 menstrual hygiene booklets, and 1,880 underpants to highly vulnerable and needy girls. The intervention has also helped to create a supportive school and community environment for young adolescents' sexual and reproductive health and rights.
During menstruation, there are emotional changes, but that is very normal to every woman. The first day of menstruation, so you count that as day 1, counting until the 28th day, okay? The next cycle is almost near. You prepare yourself.
DSW worked with teachers, parents, health service providers, county government officials, and community leaders to build the capacity to enable young adolescents enjoy sexual and reproductive health and rights. By 2019, the fruits of our work are starting to become evident. There is improvement in sexual and reproductive health and rights knowledge and skills among the adolescents within the targeted communities and schools compared to 2013.
So nikaona it's better ni chill venye nilikuwa nikiambiwa as a YAP member.
YAP club ilivyokuwa hapo na mradi DSW walivyonipatia facilitation, nilipata opportunity ya kuongea, nikisema my confidence, naambia bwana akifanya kitu kibaya kwangu namwambia excuse me, tunapata na respect. Yeah, nilipata confidence.
Na mkitoka hapa, hata kama hutatoka na kitu, toka na jambo moja, ya kuwa wewe ni kijana na umepewa nafasi, uitumie vile inavyotakikana.
An impact study conducted in January 2019 shows that the proportion of pupils reporting to have ever heard of HIV and AIDS and could explain at least 2 ways of HIV transmission and protection was 55% in 2019, up from 14.6% in 2013. On knowledge about pregnancy prevention, 43.5% of pupils interviewed in 2019 could name 2 methods on how a girl can prevent getting pregnant and name 2 methods on how a boy can prevent himself from impregnating a girl, compared to 0.6% in 2013. One of the most fruitful of our strategies was working with community action committees. DSW supported the establishment and the running of 6 community action committees designed to provide leadership in addressing cultural and societal issues that adversely affect young adolescents, including sexual and gender-based violence, child marriage, among other critical issues.
The community action committees were comprised of teachers, parents, health workers, the chief, mentors, and also some of the village elders within the communities. So we used to have community outreaches or community integrated outreaches, whereby we used to extend these services, health services and information from this center, from the health facility to the community. So you realize that communities were actually empowered, they were actually enriched with information related to sexual reproductive health.
The success of our work with community action committees means that there is an improvement in open communication with parents on knowledge and communication about children's rights, open discussions with teachers, and knowledge of gender-based issues. The proportion of parents with the ability to openly communicate with young adolescents on sexual and reproductive health topics in the intervention area rose from 18% in 2013 to 53% in 2019. More teachers, on the other hand, are reporting that they are using youth-friendly communication methods when discussing health topics with pupils.
Walimu wakajua kuhandle wale watoto in a friendly way. Ako na shida gani, kama ni mtoto msichana anamhandle hivi, kama mvulana anamhandle namna.
DSW Kenya intends to continue working with young adolescents to increase sexual and reproductive health and rights knowledge, skills and access to services among young adolescents aged 10 to 14 years, as well as other stakeholders, to create a supportive school and community environment for young adolescents' sexual and reproductive health and rights in Kilifi County and other counties in Kenya.